Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Stephanie Markovich. She is a patient advocate. Today's Kevin MD article is Medicare's decision to stop telehealth coverage in 2025, an urgent call for action. Stephanie, welcome back to the show.
Thank you for having me.
So tell us what your latest article is about for those who didn't get a chance to read it.
Well, unfortunately, I can even quote Medicare's website. They say, absent congressional action beginning January 1st, 2025, the statutory limitations that were in place for Medicare telehealth services prior to the COVID-19 PHE will retake effect for most telehealth services. So basically, that means that except for rural areas or mental health, most people on Medicare will not be able to have telehealth appointments with their doctors, nurse practitioners come January 1st. Now, this came to me as a huge shock in recent weeks because doctors' offices don't even know that this is happening. They're scheduling appointments into 2025, which actually happened to me. That's how I found out about this, is that I had an appointment scheduled, a telehealth appointment scheduled for January, and I was messaging with the doctor about a couple of other issues. And she said, "Oh, you have an appointment in January. Let's make that December because Medicare is not going to pay." So I started trying to find out ways that we could fix this because this is going to be disastrous for me. I'm a patient, disabled, and there are millions of people who this is going to take a very bad toll on. People are not going to get the help that they need. They're not going to have doctor's appointments. They're not going to end up on the treatments that they need because there are so many people for various medical reasons who are stuck at home. They can't
Mhm.
get to a medical office. And so this is a very huge problem. It's extremely urgent because as of this taping, we're getting to the end of 2024 and it says absent congressional action by the end of 2024, telehealth will no longer be an option. So I don't know if the current Congress has to take action, if they are able to, or if this will have to move to the new Congress come January. But either way, I can talk about this later too, what we can do
Sure.
to try and get Congress to act.
And just a reminder, the fact that we're in this situation was, of course, during the pandemic, Medicare made these rules because they wanted to encourage more virtual visits, of course, because of social distancing and because of the pandemic itself, right?
Exactly. So COVID was horrendous for a million reasons, but one positive that did come out of it was that people who have trouble going to a doctor's office could do it from their own home. It's much easier on the body, on the mind. It's more affordable. It's the quality of care is the same. So it just makes sense
Sure.
to continue it. There's no reason to get rid of it because it's a good thing that's working. And so, yes, it was genius when they came up with it during COVID, and it needs to be continued.
So tell me about your own personal situation, about how these virtual visits and telehealth visits, how did you utilize them over the past few years?
For the most part, most of my medical visits are telehealth. I have doctors. I live in New York, but I have them out of state. So that is very important. But even my local doctors, I have, you can't tell it from my demeanor, but because I have what people call an invisible illness, but I I really can't do much. So I can tell you like an average day for me is I need at least 12 hours of sleep just to feel okay enough to do anything like this. Or so then I would wake up, try and get myself together, wash up, eat some breakfast. Then I can do one or two tasks, maybe, take a shower, could be all I do one day or something for a medical appointment, filling out some forms. Then I take a nap because my brain and body are so exhausted. And soon enough, it's time to get ready for bed again because I have these routines and my body runs slowly and I'm extremely fatigued and my nervous system is completely shot. So everything just does not run in me the way that it should. I have an autoimmune disease that affects the autonomic nervous system, and I have ME, which is myalgic encephalomyelitis, pretty much unknown for most people, but it basically is extreme fatigue, post-exertional malaise, which is means if you do something, you get worse. So that's also a huge problem in terms of the telemedicine for post-exertional malaise. If I were to push myself, get my nervous system going, push myself with adrenaline and lose sleep and get to a doctor's appointment somehow and then come back, all of that effort and pushing will make me feel worse and my
Mhm.
symptoms will get worse. And so, yes, I went to my doctor's appointment and they're supposedly helping me with my illness, but now my illness is worse. So, if I keep doing that for I have my whole body's affected. So if I keep doing that for all of the doctors I see for all of the different areas of my body, I'm just going to be in a constant cycle of getting worse and worse. And when do I recover?
And when you talk to your fellow patients about the upcoming expiration of Medicare's coverage of virtual and telehealth visits, tell us some of the thoughts, some of the things that they're saying among the patient community.
As soon as I found out, I went in, I'm in a couple of online patient groups, and people were shocked because, as I was mentioning before, doctors' groups, doctors' offices are still scheduling appointments into 2025. Nobody is saying that I was lucky that one doctor told me. Nobody's saying that telehealth, there won't be Medicare telehealth anymore. So, the reaction, people have been shocked, they're angry and frustrated, and they're nervous. People are scared because there are many people who are worse off than me who, yes, I can force myself to get to a doctor's office if I had to. There are people who cannot go no
Mm.
matter what. So there are people who are scared that this is the end of their medical care, that they're not going to have access to care anymore. And what are they going to do? So they're also saying, what can we do? How can we get it back? It's a, it's, I don't know if I said it before, but it's really life or death and it's quality of life.
And you mentioned earlier that the care that you receive virtually, you think that is similar to the care that you receive face to face with a clinician.
Absolutely. I mean, yes, there are positives to being in person with somebody. I think most people would agree with that, that there, when you're in person, you can have different readings of facial expressions or body language. But for me and for the people that I've spoken to or been in communication with, the care has been consistently great. I mean, I saw people, medical professionals before COVID and then during COVID, and nothing changed. It was only better because it was took less of a toll on me.
So, in a way, with this Medicare coverage expiring, it almost seems like the most vulnerable populations, those who are disabled and unable to go to an in-person visit, those with chronic illnesses, they would be disproportionately affected.
Absolutely. I mean, there's the people with, as you mentioned, with disabilities, chronic illness, people who don't have energy, people with mobility issues. The elderly, of course, are on Medicare, people who are frail, people with dementia, other neurological issues. Yes, we're all going to be affected, and I'm not sure what regular health insurance is doing for telehealth. But in terms of Medicare, we need to have this coverage.
And to your knowledge, is there some type of movement, some type of media or political outcry to get this coverage back before it expires?
So I was surprised that when I found out, I didn't see advocacy organizations doing really anything about this. I did see that the AMA was in support of continuing telehealth. Other than that, I reached out again in my patient groups, and one person did mention that there, and I'll tell you what it is, on actionnetwork.org. There's a petition there where it's easy and automatic. You can go on and it basically you put in your information and it sends a letter. You can customize it if you want to. It sends letters to your representatives telling them that you want this legislation passed. So it's quick and easy to do. If to find it, I found the easiest way to do it is if you Google actionnetwork.org preserving telehealth. That's what it's called, preserving telehealth. So if you Google actionnetwork.org, preserving telehealth, then what I found that it should be in the first results that come up. And if you click that, so far there's about 14,000 signatures, signees. And that's what I found so far to be the most successful. I mean, I've tried reaching out to some newspapers and but and also like organizations for my illnesses. Some have started to take some action, but we do need if the media could cover this. That would be tremendous because that would put much more pressure. I mean, the patients and this, I mean, I'm reaching out to everybody, people who are on Medicare, people who are not on Medicare, people who know people on Medicare, or just if you're a kind-hearted person who cares about the health of others. We need, I think the Senate leader Chuck Schumer needs to be inundated. I think House Majority Leader Johnson needs to be inundated to push votes in the House and the Senate. If this goes into January and there's a new Congress, we gotta get after Donald Trump, and he wants Dr. Oz as the head of Medicare and RFK Jr. as the head of HHS. So, oh, and then Senator Thune at that point will be the leader of the Senate. So, if it comes to January, we'll have to go after the new people and hopefully with the push of representatives and hopefully if we could get the media involved somehow we can move this along.
Are you preparing yourself, however, for a world where telehealth is not covered by Medicare?
I have to face that reality. I I do have a very packed schedule in December with a lot of telehealth appointments with my providers so that I can squeeze in, at least however many months with them that I can. But it's not going to be fun. But if I have to do it, I will have to force myself to get to doctors because I mean, I need my medicine, I need their guidance, and unfortunately it will hopefully it won't become a reality, but yes, I'm unhappily preparing for the other reality.
We're talking to Stephanie Markovich. She's a patient advocate. Today's Kevin MD article is Medicare's decision to stop telehealth coverage in 2025, an urgent call for action. Stephanie, as always, will end with some take home messages that you want to leave with the Kevin MD audience.
I just ask anybody who is willing and able, who has just a few minutes to please contact your representatives. We really need your help to get this movement, to have people, the Congress, pay attention and pass the legislation to continue telehealth, to have Medicare pay for telehealth in 2025. Again, where this is a matter of saving lives, improving lives, It's a serious matter. Again, there are people like me who are a little better on the spectrum. There are worse people on the spectrum, and we can't let people hang, not in this country.
Stephanie, as always, thank you so much for sharing your story, time, and insight. And thanks again for coming back on the show.
Thanks for having me.